Dear colleagues, it's my pleasure to be with you today to give the closing keynote speech at the ICT4D and Malaria Conference. I hope you have found the conference enjoyable and informative. In the next few minutes, I would like to share with you my thoughts on malaria digital surveillance and, by extension, disease surveillance generally. In just a very short period, we've come a long way in the use of digital solutions in malaria surveillance, yet it feels like the journey is just beginning. Digital solutions have been used in malaria surveillance in several ways. They have been used in routine information systems, including community health worker information systems. They've been used in elimination surveillance systems, in case notifications, case investigations, and focus investigations. They are the backbone of outbreak and epidemic detections and response. They are increasingly being used in micro-planning and distribution of interventions such as insecticide-treated net, seasonal malaria chemoprevention, and indoor residual spraying. They're increasingly again being used in developing integrated data repositories at national levels, as well as in the monitoring and evaluation, including the monitoring and evaluation of the surveillance systems themselves. And they have become an important tool for the dissemination of guidelines and communicating with the wider community on matters related to malaria. We in WHO have been very active in this space, working with many of you partners here and across disease departments in the WHO. We have developed several standardized modules based mainly on DHIS2. These include the routine surveillance module for aggregated cases. We have the case-based surveillance module as well for elimination settings. And we have modules that can be used by countries to develop integrated malaria data repositories. As some of you may know, we also have a portal called the Malaria Threats Map, where we collate and display, using maps and other graphics, biological threats, in particular focusing on drug resistance, insecticide resistance, invasive species, and HRP2 deletions. We're currently working on developing a portal that can be used by countries to implement surveillance systems assessments based on a recently developed surveillance assessment toolkit that many of you have contributed to. Today, where we are with the digitization of surveillance systems is relatively impressive compared to where we were a few years ago. Nearly 60 countries have used DHIS2 for their HMIS. Several countries have adopted digital case-based surveillance modules. A few high-barring countries now have national integrated data repositories. And progress is happening every day, and we hope that in the next 5 years, that almost all malaria endemic countries have digital platforms for their HMIS. In WHO, we also use the digital solutions not just for surveillance purposes, but for also the communication of our own guidance. We have an app which can be installed in both iOS and Android devices that has the comprehensive malaria guidelines and recommendations. It has the detailed WHO malaria terminology, and it also hosts the World Malaria Report country-level statistics. None of this work would be possible without working with you, the global partnership, the regional partnership, and the national partnerships. Many of you are participating in this conference and are presenting experiences and have presented experiences of your support to countries. It's essential, therefore, that we continue to strengthen the digital surveillance community of practice. In doing so, we need to recognize that what works for malaria often works for other diseases, and therefore we must deliver as much as possible integrated solutions that are cost-effective and are sustainable. The tools that we use must be developed and disseminated in open access, and where possible, the source codes are made available for further adaptation and improvements. In conclusion, there's no viable future for malaria surveillance and disease surveillance in general without the use of digital solutions. However, there are a few important challenges we must address. First, in most countries, even with the digitization of surveillance data, the truth is the source registers are still paper-based, and there's no real electronic platforms at the health facilities. This has important implications for quality and coverage of surveillance systems. We need to invest in low-cost solutions that are nimble, have minimal energy, computing, and connectivity requirements to alleviate this problem. Second, we all know how care in the private sector is essential to malaria case management, but we also know how difficult it's been to integrate this sector into routine surveillance systems. We must now be creative and find ways that incentivize the sector to participate, including asking them to lead the development of solutions that work for them and work for the public sector. Third, we must actively invite to the community of practice local groups who are based in countries who can be supported to develop locally adapted solutions in a sustainable way. Currently, almost all groups that receive resources for and lead the development of surveillance solutions are from high-income countries. This is simply not a sustainable model if we want to have impact. Finally, we need to really accept that countries, and by extension communities, are our most important co-creators. We're not doing a good job of integrating solutions into national systems in sustainable ways. In this regard, I would like to end with a quote on digital solutions from Dr. Moeti, the Regional Director of the WHO Africa region. Recently, in fact this week, at a conference organized by Johns Hopkins University to celebrate World Malaria Day, she said, and her quote is on digital solutions, "We must now be strategic in order to build lasting solutions. For sustainability, digital solutions need to be co-created and nurtured within existing national systems. Indeed, we believe that digital solutions that are not considered for allocation of public resources are unlikely to survive." I know many of you are aware of these challenges, and I know many of you are working hard to alleviate them. I wish you the best of luck in your work in supporting countries to improve surveillance systems and the broader use of digital solutions in health. The WHO is committed to working with all of you and to supporting you. Thank you very much, and have a good day.